If you look at some of the two most comprehensive plans, and we're talking about replacement plans for the ACA, the two most comprehensive and the ones that are picking up the most steam, one is called, the acronym is the Patient Care Act. And care is choice, affordability, responsibility, and empowerment. Sometimes you think they pick those terms just so they make the acronym work. And another one is, it's called the Universal Exchange Plan. There are some recurring themes in both of these. Now, regardless of how you feel about the ACA, it did a couple of things. It started a discussion and put it on the front burner where it probably should have been, because this is such a drag on our national economy. Healthcare is. One in every $6 spent in this country is spent on healthcare. This is a problem that has to be fixed. It made it part of a national discussion and put it on the front burner. The other thing is, it tried some things. You know, it's easier to edit a paper than to write a paper from scratch. And so it put in place some provisions that now we know whether we like them or we don't like them, if people are hostile toward these, or if they worked. If you look at some of the polling, the majority of Americans have been opposed to the ACA, but at this point, now that the subsidies are in place, there's been a little bit of a shift, and it is this. Most people now, if you believe almost everybody's most recent polling, most people now still aren't in favor of the ACA, but they would rather fix it than repeal it. And I think that's what happens. Once people get coverage, and it has done quite a good job of reducing the number of uninsured, I think people don't want to go back to being uninsured. There are some other provisions, guarantee issue, community rating, or a modified community rating, that they decide they like. So